Why aren't my antibiotics working? Yeah, the
Because
listener in this source was 7 days post-extraction in just absolute agony, even though they were on antibiotics. Gets new crowns,
And this is
bites into a piece of soft cooked chicken, and hears this literal crunch sound inside their head. My first thought is, I just broke my $1,000 tooth. So for this deep dive, we're decoding those, those panic moments that can happen after you've already left the dentist's chair.
Yeah, that feeling where you think it should all be over.
Exactly. You think dental work is like fixing a car, they fix the part, you're done.
Yeah.
But this material, it paints a very different picture.
It really does. Because the thing is, you're not dealing with mechanics, you're dealing with biology. You're putting these like super rigid materials into a living, shifting system.
And that system, it pushes back.
It almost always pushes back.
Okay, so let's start with the sensation that, I have to be honest, freaked me out the most, the crunch. A listener gets new crowns, bites into a piece of soft cooked chicken, and hears this literal crunch sound inside their head. My first thought is, I just broke my $1,000 tooth.
And that is a totally normal reaction. But with modern materials, especially something like zirconia, that sound is almost never the tooth breaking.
Zirconia, that's that super hard ceramic stuff, right?
Incredibly hard. It's an industrial ceramic. It is way, way harder than your own natural enamel.
So if the crown isn't breaking, what on earth is that crunching sound?
It's likely the crown settling. Think of a new pair of really stiff leather shoes.
Okay.
They fit, but they have zero give at first. When you bite down, your periodontal ligament, which is basically the shock absorber for your tooth, it has to compress and shift around this new, unyielding object.
Ah, so it's the shock absorber that's making the noise.
That tiny microscopic shift, that's the sound you're hearing.
But how do you know if it's the settling versus, a catastrophic failure?
The dividing line is pain. If you hear that sound, but there's no sharp pain, no sensitivity, and the crown feels solid.
Right.
It's just the ligament adjusting. If it hurts, that's when you call the dentist.
Right. Pain is the red flag.
Always.
Speaking of pain, let's go to the worst case scenario, the dry socket.
Oh, it's brutal.
Yeah, the listener in this source was 7 days post-extraction in just absolute agony, even though they were on antibiotics.
And this is such a critical point for people to understand. A dry socket isn't actually an infection. It's a mechanical failure of your body's own bandage.
And a mechanical failure.
Yeah. When a tooth is pulled, a blood clot forms to protect the exposed bone, the exposed nerves. If that clot gets dislodged, you just have raw bone sitting there, exposed to air, to food, everything.
Okay, that explains why the listener was so frustrated. They were asking, why aren't my antibiotics working?
Because antibiotics kill bacteria. They don't. They don't cover naked nerve endings. Stop waiting for the pills to work. They won't. You need to go back to the dentist so they can physically pack that socket with medicated gauze. It acts like an artificial clot.
So it's a physical patch, not a pharmaceutical fix.
Exactly. A cover-up job.
Okay, let's shift from how things feel to how they look. A random red, veiny patch on their gums.
You see a red patch, you immediately think infection or worse. This is identified as most likely being a varix.
A varix? I didn't even know you could get those in your mouth.
You can.
Oh,
It's basically just a varicose vein, but a tiny one on your gum. Or maybe just a spot of irritation from brushing too hard.
So the rule of thumb is similar to the crunch then.
Pretty much. Is it behaving badly? If it's just a red spot, no pain, no bleeding, it's not growing, it's probably fine. Biopsy is the only way to be 100% sure.
Right. Okay, the other visual issue is less scary, maybe more. Aesthetically annoying. Yes, you get a crown on a front tooth, it's a perfect match. 5 years go by, you look in the mirror, and suddenly that crown looks fake. It's way brighter than all your other teeth.
This is the static versus dynamic problem. We think our teeth are like little rocks, but they're not. They're porous.
So they absorb stains, coffee, wine.
All of it. They darken over the years. But a ceramic crown, that's basically glass. It's color stable. It will never age.
So the crown stays 25 while the rest of your teeth turn 40.
Precisely. The natural teeth change color, and the artificial one gets left behind, looking out of place. The fix isn't a new crown, which is great news.
Because that's expensive.
And invasive. No, the solution is to whiten your natural teeth to bring them back to match the crown's original shade.
It really all comes back to that central idea, doesn't it? You can't just set it and forget it.
Not at all. Your body doesn't stop changing just because you've glued a piece of porcelain in there.
Yeah.
We want dentistry to be permanent, but we're living in impermanent bodies.
Which leaves us with a final thought to chew on. If our natural teeth are always changing, and the artificial ones are static, Does that mean a perfect smile is really just a temporary alignment in a system that's constantly moving?
Something to think about.